when a baby is born, huge amount of forces are exerted on the cranium. This, of course, is not a baby's cranium. This is an adult's cranium, but we'll use it to explain what happens. So the baby's cranium is not fully formed up here. Now, during the birth process, the head, the bones of the cranium are actually squashed together. This facilitates the passing of the baby from the womb out into the world. And then, once the baby is born, the bones of the cranium move back out into a normal position. However, that doesn't always happen. In some cases, the bones remain distorted inwards. This puts a pressure on the brain and can cause all kinds of developmental problems. Sometimes the baby's head seems to pop back out to normal, and then later on, some days or weeks later, the skull can start to distort in shape. The reason for this is that there are membranes within the skull. There's the falx cerebri, which goes between the two sides of the brain, and then there's another membrane, the tentorium, that lies underneath the brain, between the brain and the cerebellum. Now, when the birth process puts pressure on the skull, the membranes within the head are also distorted, and they can retain tension in them. So after birth, the skull may look normal to begin with, but the tension has remained in these two structures, these membranes inside the skull. And gradually, in the days and weeks after the birth, the tensions inside the skull start to put a pressure on it and to distort it. And that is why sometimes the baby's head shape changes some weeks after birth. Now, who knows what kind of problems distortions in the cranium can cause? Who knows where that will put pressures on the brain and what effects that will have on all aspects of a person's being? Who knows what can crop up later in life? What damage can be caused during the birth that everything seems fine? Maybe later in life, maybe 20, 30 years later, problems can arise. The cranial treatment that we give to babies is exceptionally gentle. It's hands-on different parts of the skull, sometimes a little bit of intraoral work. And this encourages the spine, the skull, to return to its normal shape. And more importantly than this, as we move the plates of the cranium, so that gives a gentle massage to the structures inside the skull, to those membranes separating the different parts of the brain. And tensions inside the skull can be released. That means less pressure in the head. That means reduction in headaches, at the very least. Distortions in the skull can cause pressure deep inside here, so that when the baby opens its mouth, it can lead to pain, discomfort. Distortions in the cranium can lead to feeding difficulties. So that is a brief explanation as to why all babies should have a cranial assessment and treatment after birth.